Good morning, everybody. Good morning. Welcome to Food is Medicine. I'm Jackie Carlin here in the Nutrition Theater at the Center for Health and Wellbeing. This is Allison Harrell. I'll introduce in just one moment. Welcome to our folks watching along at home and also to our folks here in the Nutrition Theater. This is going to be a fun sort of hybrid class. Anybody that has questions at any point, if you're in the room, ask them, and Allison will repeat them back so the folks at home can use it. For those folks at home, use the chat box, and we will share your questions with the folks here in the theater. Just a quick programming note, our physician, Dr. Tunc Kiymaz from Rothman Orthopaedics will be here shortly. He's been held up with some patients, so we're going to welcome him when he can get here. But Allison's going to get started with our recipes, which she'll tell you about in just a moment. For those folks here in the room, let's make sure our phones are on mute or silent so that we're not interrupting. And for those folks at home, please keep yourselves muted throughout the program so there's no interruptions as well. One other note, if anybody has to drop off at home for any point, or they join us later, which they won't be hearing this, we will share the entire recording with everybody who registered today. And so that means those folks you here in this room too. So if there's somebody that this is a really great program and you want to share it with a friend or watch along later and cook along, you guys will also get the full recording as well. And one last thing, you all will get a survey. Please do fill out that survey. Allison and I are currently planning out the rest of the year with cooking classes. So that's a really wonderful opportunity. Say you'd like to see a cooking class on, I don't know, low-carb diets or a specific disease state, hormone health, etc. Yeah, so if there's anything like that, just please let us know, and we would love to program classes that you want to see most. And again, another programming note, July, as a reminder, we have no programs here at the Center for Health and Wellbeing. It's our summer break because everybody else is out of town too. So all of our programs kept turning up empty. So we will be back in full force in August. So we should be in the next couple weeks posting all of our August, September, and beyond programs. So do watch our website, yourhealthandwellbeing.org, to be among the first to sign up. We've got a couple of them up already, but we'll be adding more in the next couple weeks ahead. So that's enough of the housekeeping notes. Just wanted to get everybody on the same page. And let me introduce our culinary medicine specialist and registered dietitian, Allison Harrell. Those of you that come here often are familiar with her. This is going to be a wonderful class. It's cooking for bone health. We'll let when Dr. Kiymaz arrives, I'm going to introduce him as well, and we'll talk a little bit more about some of the specifics of the bone health. But Allison is really great at taking different ingredients and finding ways that can help you with your overall health. And she's the queen of kitchen gadgets. So you are going to find yourself ordering things you didn't know that you needed. And then the last thing, in the chat, I will be, for those folks at home, I'll be posting a link to the recipes so you can follow along. And also a link to Allison's website. So if anybody wants to sign up, and she'll have a sheet in here too. It'll be a bone health specific newsletter, and she'll also be sending around the things that she mentions today. Okay. Enough from me. Allison, let's get us. Is your mic on? Let me turn your microphone on.
Thank you. All right.
Can you adjust this up a little bit?
Thank you. I'm eating it.
Yeah. That's it. Okay. Thank you, everybody.
Hi, everybody. My name is Allison, and yes, I am the kitchen gadget queen. My job, I feel, is to help people find solutions to get them in cooking, because whenever I work with clients, like, I don't know how to cook. I don't have time to cook. So trying to find some solutions to help make cooking a little bit easier for you in the kitchen. So I wanted to share with you what we're going to be making today. And have you guys ever gone to First Watch restaurant before? They have this dish that I absolutely love, and it's got sweet potatoes, eggs, any style, and like an arugula lemon vinaigrette salad. So I'm kind of like imitating that, but I'm doing egg bites, kind of copycat of the Starbucks egg bites, the red pepper and onion one. And then also, I'm going to be making a watermelon strawberry slush mocktail as well. So for our egg bites, the way they get them really fluffy is they add in some cottage cheese for some extra protein, and then they sous vide it, which is like taking a pan and adding hot water to the bottom and cooking it with the hot water on the bottom. That kind of steams it and makes it fluffy. So I'm just taking some hot water from the faucet and pouring it into the bottom of my casserole dish. Have you guys tried the egg bites at Starbucks before? They're pretty good. They also sell them at Costco. And we do compost here. It's O-Town compost. They come and collect all of our scraps, and they turn it into really good, juicy soil for gardening. So you could either have them bring back the soil so you can have your own garden, or you can donate the scraps so they can provide soil for other areas. And it's really good to do that because our soil here in Florida is really sandy, and it's hard to grow a lot of stuff unless you have a real nutrient dense soil. So composting is good. But for me, I'm not going to be dealing with the bugs and all that stuff at home. So I like that they do the composting for me and just bring me the soil so I can use it in my garden. And hello. So, okay. So what I'm going to be doing is our egg bites is going to be a mixture of eggs, the cottage cheese. I took some roasted red peppers because I like this because it's already soft. If I were to take fresh red peppers, it would be it would be a little bit more tough in the egg bites. I found it tastes better when it's already roasted. And I just took them out and I broke them up and put them in the little muffin cups that I've sprayed with olive oil spray. The oils that I like to use is olive oil spray or avocado oil spray. And these are high in omega-3 fatty acids. The seed oils that you will find in a lot of ingredients in the grocery store are high in omega-6 fatty acids, but they go through a chemical process that makes it very inflammatory. Those seed oils are the cheaper oils too. So you'll find a lot of the processed foods use seed oils. So it's really important to look on the food list, ingredient list to see what kind of oils are being used. I challenge you when you go to the grocery store and look at all the wide variety of salad dressings that are on the shelf. It's going to be hard to find any that's truly olive oil or avocado oil based. Primal Kitchen is a brand that I really like, and it's avocado oil. Even if it's like oil and vinegar salad dressing on the front of the label, made with olive oil, you look at the back and chances are there's more seed oils and less olive oil in it because the seed oils are cheaper. When I went to UF, I had to take a food science class, and we had to test out the salad dressing for Olive Garden salad dressing, and I was shocked that barely any of it was olive oil. You know, you would think it is, but it's like all these other inflammatory oils. So protein is also really important for our bone health as well. So that's why I'm incorporating cottage cheese into our eggs to boost the protein levels of that. So let me add our cottage cheese. Cottage cheese seems to be all the rage lately. If you're on social, oh yeah, that's so much better. If you're on social media, you'll see cottage cheese wraps. You'll see, it made me have a deep voice all of a sudden. So I really love cottage cheese because you can add it to a lot of different things, like this egg dish. You could also add it to smoothies. You can make egg or like a bread wrap, like I mentioned earlier. Desserts. You can whip it up and have it like ricotta cheese on toast. You can put it in stuffed shells, lots of different stuff. So I'm adding a half a cup of cottage cheese, which is also loaded with calcium. And in the handouts that I'm going to email to you guys, if you opt in afterwards, I have lists of good sources of calcium, vitamin D, vitamin K, and magnesium. All those nutrients are important to help with bone mineralization. I like to look at my plate and think, what can I add to it to help me have, a better healthy dish versus what can't I have? So if you focus on all the positive stuff you can add to your dishes, then you're not so focused on eliminating bad things, you know what I mean? Okay, so what I'm going to do is I'm going to add a little bit of salt and pepper to this, and then I'm going to whip it up. There we go. And whip it. Whoa, that was hot. So I just whipped it up. So some people are kind of picky with their cottage cheese. They don't like the curds. So I like to whip it up for people. Everybody's good with dairy, right? Because we're going to be using a lot of dairy in this class. But I like Swiss cheese. So I'm going to add a little bit of Swiss cheese into our muffin tins. So do you guys like to cook at home? Like, what's your style? Do you eat out a lot? Do you guys prefer to cook? You prefer to cook? Good. I like to do batch cooking because sometimes I just don't feel like cooking, you know? So this is a great dish that you can batch cook, make it all at once, and then store it in an airtight container in your refrigerator and reheat it. You could also freeze it. So this is great if you're a busy lady, you know, visiting, you know, going out and doing things like coming here to work out or, you know, working or whatnot, to have a good, healthy dish that you could have for any meal, breakfast, lunch, or dinner. This would be a great option.
Allison, while you're doing that, we have our first question at home, and it's relevant to what you were talking about. From Kim's wondering, low fat or fat-free cottage cheese, or do you use full fat?
I'm using low fat. You could use full fat. I don't like the fat-free stuff because it doesn't really have much flavor. And a lot of times if you're buying something that's fat-free, they're adding something else to it, like sugar or carbohydrates. That's not going to be good for your overall health. I grew up in the Snackwells era in the 90s in college, so everything was fat-free. And I can remember freaking out about whatever I ate had to be fat-free, and I ended up gaining the freshman 15 because I was avoiding all fat, and because the foods that I was eating had so much carb in it. Fats are important, and it helps you absorb your fat-soluble vitamins A, D, E, and K. And D and K are really important for bone mineralization, so you don't want to be malabsorbing those fat-soluble vitamins. So healthy fats are what's important. And I love avocado. Adding that would have been a good addition to the arugula salad as well. But fat is not the villain. I chose this Good Culture cottage cheese. It's a fairly new brand that I've seen. It's got 80 calories, 14 grams of protein in it. So that is delicious. I even mix cottage cheese with plain Greek yogurt, and that makes a good breakfast with some berries and chia seeds and hemp, lots of different things. All right, so you could use, I'm using Swiss for this. You could use any style cheese that you want. And what I'm gonna do is I'm just gonna pour over the egg.
And while we're still on cottage cheese, before we move on, somebody said they used to get the Friendship brand with no added salt, but they don't seem to make it anymore. Does this brand have unsalted, or what are your thoughts on?
I haven't seen unsalted. This has, gosh, I'm old. I can't see very well. 340 milligrams of sodium in it. So it does have some sodium in it, but I don't really add a lot of salt to my foods. And if you're making food and not buying processed food, you're not getting a lot of salt in your food anyway. And your body does need some salt. So, but if you're following a highly processed, ready packaged diet, yes, you probably would want to pay attention to the salt in your cottage cheese. But like this meal is, making it from whole foods that are low in sodium, so that would be okay. It would. She asked, would this work with a metal muffin tin? And yes, it would, but you just got to make sure you can fit it in the casserole dish and be able to add the water underneath. All right, there we go. All right. And whoop. So I'm going to carefully pour in.
Can I ask why you're pouring?
Please.
We've got lots of cottage cheese questions. Okay. As you hit your head on the nail, this is a very big ingredient a lot of people are using right now.
Yeah.
And one of them has to do with the cultures, especially in Good Culture cottage cheese. So L. Richards was wondering, does cooking or baking items with cultures kill the cultures?
It can, yes. It definitely can. So if you're using it for a probiotic reason, just know it's probably going to kill some of that, and find other ways to add in probiotics into your diet with fermented foods, not having versions that are not cooked. You can make ice cream with cottage cheese. I like it for not just the cultures, I like it for the protein as well. So you kind of have to pick and choose. And but if you're worried about probiotics, there's lots of like kombucha, but pay attention to how much sugar is in those kombuchas, because you're going to be shocked to see that it's loaded with a lot of sugar in most of the brands. I think Synergy is a brand that I've found that has no added sugar to it. So that's one that you're going to want to look for. The Cleveland Kitchen is a really good brand that just started making pickles. They have lightly fermented pickles, and they have Asian vegetables and pickled onions. And then you find those in the vegan, vegetarian section in the produce section at your grocery store, or Publix mainly. And if you buy pickles on the shelf, they are not going to have the probiotics in there. You want to buy the refrigerated pickles. And it'll say lightly fermented on it. Cleveland Kitchen also makes salad dressings that has some probiotics in it as well. Tempeh is a really good source of probiotics too. Those are fermented soybeans, and you can use that in dishes like to make tacos. I've used it to make picadillo. Have you guys tried tempeh before? It's kind of different, you know, but I like it. It has a good texture to it, and can be a good plant-based substitute for beef or ground meats. All right, let's see. I was getting nervous that I wouldn't be able to fill all my cups, but here we go. I made it! Yay! Awesome. All right. So I'm going to put this in the refrigerator at the same time as the sweet potatoes. The sweet potatoes, I'm just going to spray with, you can do avocado oil or olive oil spray. I had the olive oil spray at home, so that's what we're doing today. I'm just going to spray it. Put a little salt and pepper on it. Before I cook it, yeah. Pardon? Oh, no, I didn't. I just put parchment paper on the bottom and it won't stick. She asked did I spray the pan. If I wasn't using parchment paper, yes, I would spray the pan. But I like to use parchment paper because then when you're done, you just lift up the paper and you slide it out onto your dish, and it is less mess. I'm all about less mess in the kitchen. I love getting the kitchen dirty, but I really hate cleaning up after myself. So it's good if you have a partner that likes to clean. I force my children to help me. All right. There we go. Okay. So the sweet potatoes are going to be baked at 400 degrees. That is the lower oven. Here we go. And then the eggs are going to go on the top at 325. You could put anything in these egg bites. I just chose the green onions and the roasted peppers, but you could put, if you want meat, you could put bacon or sausage in it. You could just have cheese or find a different vegetable that you would like to put in there. All right, set timer for 10 minutes. So midway, I'm going to rotate the sheet pan around so that they cook all the way through. And with the sweet potatoes, I'm going to see if I need to toss them and turn them over, flipping them over midway. I didn't show you this. Okay, so with the scallions or green onions, I like to store it in water. And when you store it in water, you can regrow them. They grow pretty quick. I just cut this off, but in the past, like say I cut this 2 days ago, for instance, it would shoot up about that high. So you can regrow your green onions. You can plant them in the soil, which would be even better. And for here, these are one of my favorite kitchen gadgets. It's herb scissors. So you just do that, and it cuts perfect little slices. So that is a kitchen gadget I absolutely love, and I'll share my Amazon store in the follow-up email of all. I have like 52 kitchen gadgets in there, so you'll see all my secrets. So there we have that, and then yes. They do, because I'm not using them so much, like all the time. And it comes with a top that you can, let me show you. You can clean it. So this is like the protective thing to keep it, but then when you open it, this will clean it. So you don't put your fingers on it. I did that, and that was not a good idea. It hurt. So that's a good, I like this gadget because it helps you clean it, because it does get stuck in the middle of that. But they're fairly inexpensive. I've had mine for a couple years and it's still good. But when it gets dull, I could either pay someone to sharpen it. It'd probably be cheaper just to buy a new one. I think it's like $10 for that thing. All right, so let's move on. And while that's cooking, I'm going to be making, I want to see the timer. Okay, I want to make sure back up we got the timer set. I'm going to make the dressing that's going to go with the salad. I was going to just do arugula, but when I went to the store, they had spinach and arugula blend, so we're getting a bonus of the spinach and arugula together. And the leafy greens have a lot of vitamins and nutrients in it that are going to help support your body to mineralize your bones with the calcium, magnesium, vitamin K, vitamin D, and things like that. So this recipe calls for olive oil. I'm not going to use this today, but I wanted to show it to you. This is a great olive oil dispenser. You can measure out exactly how many teaspoons or tablespoons you want and then pour it out. Since I need a 1/3 cup, I'm just going to pour it in here. All right, let's see. All right, so I like this little container. You could take a mason jar. I didn't bring any here. I save all my little mayonnaise and sauce jars just to recycle and use them at home instead of buying mason jars. So oftentimes I'll make my salad dressing and just shake it up in one of these jars to help emulsify it. And okay, so we need lemon juice. This is like the best heavy-duty citrus squeezer. I got that on Amazon as well. And to help get the juice out, I am going to roll it and cut it. To keep your knives sharp, you don't want to scrape it on your cutting board when you're chopping up stuff, because that will dull the blade. That little stick that you get, the honing stick that you get in your butcher block, this is not going to sharpen your blade. This is just going to maintain the sharpness. So if your knives are dull, you're going to want to get them professionally sharpened. There's a guy named Grumpy that goes to all the farmers markets in the area, and he is grumpy, but he sharpens knives. I've also been told by my husband that Bass Pro Shops sharpens knives for free, but I haven't tested that out because I don't know if he just wants me to go to Bass Pro Shops with him. It's probably the case. But I also feel weird about bringing all my knives into a store. I'm like, are they going to think I'm going to rob them or what? So I'm going to measure out 1/4 cup of lemon juice, and that is about 2 lemons. All right. And I see hi. So I'm going to squeeze the 2 lemons in here and make sure I keep the seeds out of our dressing. The vitamin C in the citrus will help you absorb iron as well. All right. So this is about 1/4. You could. You could do orange. You could do grapefruit. She was asking, could you use lime juice instead of lemon? And yes, you could absolutely do it. You could use avocado oil instead of the olive oil if you want. All right, and then we need mustard.
All right, Allison, I'm going to interrupt you for just one moment because we have a special guest that's just arrived in the Nutrition Theater. So come on over with me, fresh out of the waiting or the patient rooms. Welcome, Dr. Kiymaz. He's joining us here from Rothman Orthopaedics at Advent Health. So we're very excited to have you here. Welcome today. And just to bring him up to speed, we got folks at home and we got folks here in the room. And I've already got some questions for you that I'll throw at you a couple seconds
lovely.
from home.
Awesome.
But we'll let you get up to speed. But just to introduce everybody real quick, he is double board certified, fellowship trained physician specializing in sports medicine and physical medicine and rehab. I love all of his experience mostly because I didn't realize he used to work with the Eagles, and I'm a huge Eagles fan. So we might talk about that offline afterwards. But yeah, he did his undergrad at Harvard. I don't know if anyone's ever heard of it. He went to med school at Wake Forest, and he's actually a local boy, went to Winter Park High School.
Did, yeah.
So right here in our backyard. So we're thrilled to have him here today, and I'm going to let you guys keep cooking. And you know, as you have a couple minutes, he might just tell you a few things, his thoughts on how nutrition plays a part in bone health, and we'll bother him with questions throughout the program then. So thank you. Welcome.
So I've already made the egg bites, and they're in the oven, and I've already made the roasted sweet potatoes are cooking as well. So I'm making the lemon vinaigrette to go with our spinach and arugula to serve with that, and then we're gonna also make. Oh, I forgot to tell you guys, I'm making a peanut butter and jelly smoothie bowl as well. So it could be like a dessert or it could be a breakfast. And then we're going to do a watermelon slushy, strawberry slushy mocktail.
Sounds delicious.
So, all right. So, what questions did we have?
It's very long, so you keep going. Let's have the talk just as you catch your breath and as Allison's making the vinaigrette. Just, briefly, when you see your patients, what do you tell them? I think a lot of folks, we've got a couple questions about osteopenia, osteoporosis, either from a preventative standpoint or treatment. How big of a role does nutrition play in bone health?
Yeah, so in our line of work, exercise is always the biggest aspect that we always talk about, and sometimes, unfortunately, what ends up getting overlooked is the nutrition aspect. And in all walks of life, not across all ages, people say, "Oh, I work out this much, I work out this much," but nobody really, unfortunately, not as many people talk about what they eat, and that's kind of the most important thing when you really think about what are you putting into your body, what are you putting in to fuel your body, because the interesting thing that the body's not static; it's constantly degrading and building, and that process requires the appropriate building blocks in order to make that process actually be productive. And so when we talk about, for example, osteoporosis or osteopenia, right? Same thing with our bones. They're constantly degrading and building, and that bone turnover is really important to having that healthy bone. So I think that concept kind of gets overlooked often, where it's just like, well, the bone is there, it just stays there, and that's the bone. But no, the constant turnover, and so what ends up happening is if, for example, there's deficiencies in calcium or vitamin D, that turnover doesn't exactly happen as much. And same thing, for example, after menopause, where estrogen can have a protective effect. And so sure, the degrading of the bone is present, but then the building back up of the bone, if that's missing, then what ends up happening is you start having decreased bone density, and it's not as strong, and that's where we talk about osteopenia, and then osteoporosis as a kind of more severe form of the penia. So, and that's just kind of generally concepts. I think those are all important factors to think about. Is what are we putting into our body specifically, and that's kind of where it starts in the kitchen, right?
Yeah, exactly. And someone was asking about the fat, like, do we use fat-free or full-fat cottage cheese? And that maybe, as you were talking, I was reminded that our bones actually have some fat in it too, and we do need fat in our diet and for our bone health as well. So, sorry, I got the timer. I got to check my food and see.
Let's scroll back up to this question because it's relevant. Allison is currently making a green salad over there. And one of the questions was somebody reading really that oxalates bind to calcium in dark leafy greens and prevent your body from actually absorbing the quantity of calcium that the greens contain. So is there any way to mean, greens are a good thing. We know greens are always a good thing, but is there something we can do nutrition-wise that maybe can help with that? And this was the person that said she's got osteopenia and shattered her femur 2 years ago, and she's desperate to know how to get these minerals into her diet.
Absolutely, yeah. I mean, that's a great point I was going to bring up. So, yeah, some people think of, sure, there's the calcium in the spinach, right, it exists, but you also have the oxalates that prevent that uptake. That's actually very correct. And so we, generally speaking, or at least I don't really consider spinach to be the source of the calcium that you want to be getting at, but there's plenty of other different places that you can get that source from, and so that's what we say the complements. So instead of focusing on just, saying, oh, this is a good source, I'm just going to only eat this, and that's where the variety is the most important. Sure, and like you said, spinach is a great source of many other nutrients, and so you're going to use that, but when it comes to specifically for the calcium, certainly want to be mixing it up with a variety of different other leafy greens that you can get it from, whether it's kale is a great source, or whether it's broccoli, for example. Those are all just examples. I mean, kind of off the top of my head. I don't know if you had any others.
I had... There's spinach in this only because I went to a Walmart grocery and that's all they had that had arugula in it, and they didn't have any arugula. So is that or icebergs? And I'm like, well, all right, I'm going to do that. So what source of nutrient were you talking about? I'm sorry.
So we're talking about calcium, for example. So when you have the oxalates that bind to the calcium and preventing that uptake.
I have handouts that I'm going to be emailing everybody afterwards, but like collard greens, kale, edamame are the green ingredients that have calcium in it, and other plant-based sources would be like tofu, white beans, chia seeds, which we have for our smoothie bowl, and dried figs would be another one. So it's more concentrated. This is just how, figs are good too, but dried, saying there's only like 13 milligrams per one fig, so it's not that much, but showing that there are some calcium in some figs as well. And then we also, on that same handout, you're going to have vitamin D sources, and I'm going to give you some magnesium and vitamin K sources as well. The oven was not preheated. I'm so sorry. So we're going to go on to our mocktail. All right. So let's talk about why mocktails. Alcohol, how does that affect everything?
Well, as you can imagine, alcohol does have some deleterious effects on unborn health. So that's something that we want to kind of, in moderation, right, is what we want to keep in mind. Certainly, everyone's different in what they desired consumption, but the fact does remain that alcohol does have a negative effect on bone health, and so sometimes it's nice, or as much as you can rather, it's nice to try and substitute for other alternatives, which is like kind of what we're talking about today, is doing mocktails where same great taste and enjoyment and refreshing nature of the beverage, but without that. Without the alcohol, kind of helps, again, for better bone health. That's kind of what we're looking for.
And like when you're socializing, sometimes people are like, why are you drinking? Why are you drinking? The drink pushers. So if you have like a mocktail station, you could opt to add the alcohol to it or not. Also, if you're at a party and people are pushing, just grab a seltzer drink and put a lime in it, and people aren't even going to know. And it's not their business anyway. So what I am going to be adding is some frozen watermelon and frozen strawberries. I'm like a kid in the candy store when I go to the farmer's market, and I buy a lot of fruits and vegetables, but then it may start to go bad. So I will cut it all up and put it in my freezer, and you'd be surprised at how much you could use of frozen fruits and vegetables and different things. Like this morning I made my smoothie to come here, and I used frozen zucchini as ice cubes instead of ice, because that's giving me another serving of veggies and more fiber in it, and you can't even taste it. You would be shocked. So you can freeze little baby tomatoes as well. So when you're roasting asparagus on a sheet pan, throw on some of those frozen tomatoes, and there you can have that. I don't like to waste anything, so I make sure I utilize my freezer as much as possible. So I had this huge watermelon, so I have another half of it in my freezer so I can make these mocktails when I have a party. For my 50th birthday, that's going to be next month. Like, what the heck? How did that happen?
Allison, as you're measuring that out, I know one of the reasons for doing the mocktails was to avoid alcohol. And I don't know if you guys already talked about it. I just step out of the room for a moment.
Yes.
But the question, too, is, are carbonated beverages harmful to bone health?
Isn't it more the colas, the phosphoric acid in the colas?
Right. And not just bone health, but also for the teeth as well. So those are all, again, in moderation. Can't really be staying, there's also pleasures to life, of course. And so that's where you start thinking about the pluses and minuses and not really overdoing certain things, but also sometimes if it just makes you happy to have a cola or what have you, I truly do believe moderation is important. But when it comes to the actual, negative effects, certainly there's, and the sugars as well is
the high fructose corn syrup in the regular sodas, that you need to avoid. I would completely eliminate that from your diet. I used to drink Coke like it was my job growing up. And then I switched to Diet Pepsi after college, and it's just so bad for your overall health of artificial sweeteners and the high fructose corn syrup. It's taxing on your liver. Yeah. So I would avoid the high fructose corn syrup, and it's in pretty much every regular soda, unfortunately. My husband loves soda. When we were dating 5 or 7 years ago, he didn't drink soda, and all of a sudden he got comfortable and he's drinking soda again.
It should be the opposite, married a registered dietitian.
Yeah, totally. I mean, I did find 6 chocolate candy bars in his underwear drawer the other day. So he's like, well, you told me to hide it from you. I'm like, okay.
And as she's doing this, you may have addressed this, but to go back to the plant foods versus dairy for calcium, is calcium kind of the gold standard or dairy the gold standard for getting calcium in, or is when you're talking about food and calcium intake, what's your top suggestions?
I mean, again, the varieties is the key. So you don't want to depend on just one type of food or one area of food, and that's where mixing it up is the best way, because it's not like it's not a checkbox. I don't like to view it as like a checkbox of, do I have my calcium? Yes, done. Do I have my vitamin D? Yes, done. I do think every food has its advantages and disadvantages in like the different ratios. And so when you have that mixing, it's almost like diversification of stocks, right? You want to have a bunch of all the different sources, and so I think a healthy mix of both the dairies and the greens would be ideal. And when it comes to vitamin D, there's actually a third component that we sometimes forget, is the sunlight. So it's not just the food that we eat, but also we get our vitamin D from the sunlight. And so when I was up in Philly previously, it was really interesting. In the winter months, sometimes we would spot check vitamin D for some of my patients, and they would actually have low vitamin D levels. And just surprisingly, we'd find that. And the more I checked it, the more I realized, oh my God, this is actually a thing. It actually does exist. Mm-hmm. And I started supplementing vitamin D to some of my patients, or some of them even needing the weekly higher dose supplements because it was so low. I mean, it's dark. It's, sun sets at like, 4:30, 5 p.m.
Sounds miserable.
Well, I'm in Florida now. Yeah.
In Nordic countries, Scandinavia, how do they cope?
So
The question's about because folks at home can't hear her. So Scandinavian countries, Nordic countries, how do what's their health like?
Some of it is literal supplementation, like actual supplementation orally with whether it's the pills, and kind of encouragement more and more during the day to go out for walks or what have you, as much sunlight as possible during those times, of course, and so.
And like wild salmon, cod liver oil, eggs, wild mushrooms, they are all good sources of vitamin D as well. But we wear sunscreen, so that's another thing. So getting 15 minutes of pure sunlight is I would say the max. You also have to be careful about the skin cancer as well.
True. Yeah.
And what lab level are you good with? I know 30 is normal, but I like to see at least like 50. Yeah. And I used to work in a cystic fibrosis center, and every patient of mine was deficient in vitamin D, so we were supplementing that. So that's a vitamin I supplement, just even though I go outside and I eat foods containing vitamin D. I just want to make sure it's my insurance policy that I'm getting enough, because it acts as a hormone in your body as well. And it's going to be very challenging to get a toxic level, because the upper limit is 100. So I've never seen anybody over 70. So chances are you're not going to get to a toxic level, but your primary care physician should be checking annually what your vitamin D levels are, and if they're not, ask them. And this is a plug to go see your doctor and get your baseline lab values, just so you know where you're at, so you can see what kind of dietary changes do I need to make, or what kind of supplements do I need to add into my daily routine.
Actually, we have a question right now about a blood test that Dr. Kiymaz might be able to weigh in. As somebody saying, if you're taking supplements, is that affecting your blood levels, or is there a reason to stop taking vitamin D, magnesium, and calcium prior to blood work, or do you want that accounted into your blood work?
No, you don't. You wouldn't necessarily need to stop taking a supplement if you're taking it. That's kind of the idea, is that is your intake, right? And the purpose of blood work is to see what is your level with my current normal intake. What is your intake at baseline, and what does that intake correspond to your current blood levels? And that's the idea of getting the lab in the first place, right? And so, adjustments can be made based on that, based on what your results of the labs are, certainly. But yeah, the important thing really is just to kind of see at that snapshot of time, what is your level at that time, and make those adjustments as necessary based on that.
And this is a really good moment, I think, to talk about supplements, because I think we've had different folks say different things in here too. I mean, I know the hard thing with supplements is they're not regulated,
exactly,
and there's a lot of different things on the market. I mean, what's your general advice to your patients about supplements of either a specific vitamin or mineral they should be supplementing, or even if you want to say a specific kind, no free ads, but that's okay in this case.
So generally speaking, I do like the general multivitamin. The once a day multivitamin is very reasonable. But when it comes to specific supplementation, I mean, if you do have concerns, I think generally speaking, bringing it up with your physician and saying, hey, you know what, I do have concerns for XYZ because of XYZ reason, whether it's a family member that may have had it and a deficiency in some vitamin or nutrient, and so if your physician feels like that may be a good time to check whether it's an iron level, if your energy is low, for example, and say, you know what, my sister had low iron, I'm concerned that might be the case for myself as well. Certainly, I think that would be reasonable to bring it up, and they can check your iron levels and make that supplementation as necessary based on those results. But generally speaking, I think a daily multivitamin is usually sufficient.
Yeah, and that made me think, I don't like fish, and I'm a native Floridian. Can you believe that? My dad used to go fishing all the time and say, come here, Allie, let's see what the fish ate. That's going to make me want to eat it. And okay, all right. And so I don't like fish, and that's a really good source of omega-3 fatty acids. So I take a supplement for that, but I don't do the fish oil, because I don't want fish burps. So I do a supplement that is made from the algae the fish eat. So I skip the fish part. So you just kind of have to look at what your dietary patterns are, and if you're not getting enough vitamin D or calcium or omega-3s, that's where you would want to talk to your physician or dietitian about that. Yeah, I can't. I'm scared of that. I don't want to burp it up. She's talking about krill oil. Okay, all right. Well, when I see that, I'm like, I just remember my parents in the kitchen with their spoons feeding each other cod liver oil, and I'm like, there's no way.
Allison, I got the ones called burpless, though. There's fish oil pills called burpless.
I don't trust it.
I'm going to bring you a couple of mine, and you can try it, okay? It's burpless. Okay. It says it on the bottle now, burpless.
Okay, good. And
Allison, you've made me expand my horizons. I'm going to help you.
I did try gag grouper last week because my husband caught it, and then I did try mahi over the last few days. My whole thing is picky eaters. A lot of times I'm introducing plant-based foods like tofu and tempeh, and people are like, no, but you got to try it. Just because you don't like it in the past doesn't mean you won't like it now. And I did like the gag grouper, and I did like raw tuna when I tried my son's catch. So whenever I'm with someone that's eating fish, I will try it. I even did it here. I was making a tofu dish, and people were like, ew. And I'm like, well, if you try the tofu, I'll try the raw salmon that they're serving at the place, and I had to do it. And I had a couple bites, and I liked it. I'm going to make another batch of this.
And then I also just want to quickly, while we have a little bit of time, put my plug in for the importance of exercise. I know this is diet, but as a sports medicine physician, I do think it's very important, the exercise component, where, again, for bone health specifically, bones, I was talking earlier about the kind of the breakdown and buildup and breakdown and buildup. With walking, with activity, with use of our bodies, this is why we say use it or lose it, right? That the importance of being active is so key for bone health because, again, that it's almost like similar to how bodybuilders will build up their muscle by gradually increasing the stress, which is, increasing the weight. And that's what it is when you're walking, you're technically stressing your bones, but in an acceptable amount in which there's the appropriate breakdown and your body can react by building up the bone as well. And so that kind of interplay is really important. And so I just want to make sure I'm
Definitely.
I have to put in the plug. I have to put in the plug.
Well, and we'll put in the plug for the Crosby Wellness Center here at the Center for Health and Wellbeing. Everybody can have a free guest pass that's here today, and we've got tons of programs that can help out with bone health. And to that point too, I've always heard that walking is really great for it. I used to hear like jumping or things with impact I remember there used to be like those shake machines at gyms. I haven't seen one of those in a while, but I remember that was always billed as a bone health machine.
Yeah.
I mean, is there some types of activity that's better than others?
Honestly, at the end of the day, you
movement
just
is
got to
movement.
do movement.
Yeah.
I mean, sometimes there's even in the strength and conditioning community, a lot of get to the nitty gritty of like which type of exercises or specifically what degree of motion should I be doing this exercise in. Honestly, after a certain point, you just go, you got to move.
Yeah.
Be active. Live life. Sometimes you just kind of get lost in the nitty gritty, and I don't know if there's really that much clinical difference. And sometimes it's also just easier to get people doing stuff,
Successful aging studies show that individuals who follow the individuals who smoked and exercised were healthier than individuals who didn't smoke and
Didn't exercise.
Wow. She was saying that.
Yeah.
smoke.
Right. she was saying that.
Can't condone smoking.
It was in a study you saw?
It's called the MacArthur Successful Aging Studies, where their view was to follow people who aged well as opposed to focusing on disease.
Uh-huh.
And so they followed them for 10 years, I think, or 15 years. And those who, as I said, smoked and exercised were healthier than those who did not smoke but did not exercise.
So she was saying in a study where they followed people over a number of years, the people that aged better, exercise was the key component. So the smokers who exercised aged better than the non-smokers who didn't exercise. Doesn't mean to start smoking, but it just shows how important exercise is in our overall health. I just invested in a weighted vest. So I'm like, I like to walk now, and as you get older, I don't want to be doing so much HIIT training because that definitely can raise your cortisol levels. I want to do more resistance weight training to maintain the muscles that I have, because your body naturally loses muscle mass as we age. It's something called sarcopenia. So you really need to work hard to maintain the muscles that you have or build the muscles. So don't be intimidated by going into the Crosby Center and asking for help to do these weight resistance machines. I know it can be a little scary going in there not knowing how to use the different machines, but they have people in there to help you learn. And find a friend and go for a walk. That helps with your hips and movement and stuff like that. And yoga and stretching is really key, because as we get older, or just we're so addicted to our phones or the computer, we're not as flexible. So you really want to find some exercise that's going to increase your flexibility. It also helps your mental health as well with doing yoga. I just came back from a retreat and we did yoga on the beach 2 days in a row, and I'm like, I need to do this more. I need to move to the beach. No, I'm just kidding. I need to do this more. So it's really important to get all different aspects of exercise in addition to the good nutrition. And the protein is important for bones as well, and also for building your muscle.
Are there exercises you shouldn't do because you're
Great question.
She asked, are there exercises you shouldn't do because of osteoporosis?
Yeah, so the biggest thing is I keep going back to this harping on the concept of balance, right? And that's, I guess, ultimately, philosophically, right? That's what is life, right? That's except balance, right? So that's a great question. So one of the big things I always tell patients is listen to your body, because your body will tell you when it's too much, when you come to a point where it's too much. This is present not just in osteoporosis, but also very common osteoarthritis, of various joints, where exercise is the answer. But then also, once your body starts telling you, hey, this hurts, I don't like this, you have to start making a decision but I thought exercise was the answer. Why don't I keep exercising to make the pain? And so that's where you start saying you have to back off and know your body. And so while maybe not a specific exercise that is bad for osteoporosis, so to speak, I can pretty confidently, generally speaking, anything that pushes past your body's limits would be, quote, bad for your exercise, for any form of osteoporosis. Yeah. But yeah, good question though. That's really important to understand the other aspect of it, the opposite side of that coin.
And that's why working with one of the people that work at Crosby, the trainers, can help guide you into what exercises are going to be good specifically for you. All right, here we go.
Sorry, we've got lots more questions in the chat. So she's doing that, I'm going to load you up. So we've had a couple questions now come in specifically about the risk of benefits of medications such as Fosamax.
Such as Phosphomax?
Yeah, I may have said it right, yeah.
So that's going to be, that's a...
It's probably highly personal.
I was just
going
to say, that's a little bit more personal because it depends on a lot on the levels, your activity, kidney function, a whole host of factors that are pretty unique to each patient. So I would just say if that's something that is a concern or questions regarding that, I think your primary care physician would be the ideal person to talk to because they know your blood levels that you do have and your kidney function and all that. So I would probably venture to say probably better or more personalized question. Yeah.
And then there's a question about the importance of vitamin K in bone health. I don't know if we've talked about that so much. I know it was in your notes, Allison, but especially when supplementing with calcium and or vitamin D.
I have a bunch of vitamin K sources here. Chicken, beef, cheese, sockeye salmon, kale, spinach, broccoli, collard greens, and soybeans are all good sources of vitamin K.
Somebody actually asked earlier about they're not eating as much meat anymore, so chicken. So would other legumes be a good source of that? Or I know you mentioned soybeans there at the end, but...
Yes. So I don't know exactly how much. That might be something that you would want to supplement because... Well, actually, there's less vitamin K in chicken than there is in soybeans. Soybeans is a better source. And there's less in beef. So doing the plant-based is actually going to be better.
And then let me keep scrolling.
That's good.
Sorry, I had a question.
Nice little mix of everything. I like it.
I need to turn them over.
What are you looking for, Allison?
I lost my tongs.
There was a question, too, about, Allison had talked about this before you arrived, about, when we were talking about cottage cheese, low fat or fat-free versus whole milk or whole fat. Is there a difference in calcium when it comes to whole fat dairy versus non-fat or low-fat dairy?
I don't know.
I'm actually not sure.
I'm not really sure. I would just look at the label. I don't necessarily think so, but I haven't. No, I don't think so, but I'd have to check the label. And all these different varieties of cottage cheeses and products, you really always need to look at the nutrition facts label and the ingredient list, because you just have no idea what they're adding in. Some people, like if it says enriched, they've likely stripped it of something and are adding in something to improve the benefit. So always look at the nutrition facts label on the back. And your body can only absorb about 500 milligrams of calcium at a time. So I don't want you to go to the store and be like, oh, I'm going to buy a calcium supplement. I'm going to take 1,000 milligrams in the morning. That's not going to benefit you. You're going to have, a waste of money there. So,
well, we just talked about different sources for it, but somebody was curious how vitamin K does affect bone health. I don't know. I think that's one of those ones people don't hear as much. You think of calcium naturally, but how, without going, a full lecture in terms of like we're sitting in a class, but we're interested in the science bit of it.
Going back to the biochems.
It helps with bone mineralization with the magnesium and the vitamin D. It just, I was listening to something like bone spurs are formed because you're not having enough magnesium and some of the other vitamins and minerals, so that it kind of just creates a bone spur. It doesn't let the calcium go into the bones like it should. So I'm not really 100% sure on the mechanism for the vitamin K, but I know for magnesium you kind of want to have it more of a 1-to-1 ratio. Yeah?
I just wanted to ask, I know there are all different kinds of magnesium.
I have a
Is there one particular one that it seems to me you're supposed to get?
I recommend magnesium glycinate over all of them. Glycinate, and I'm going to give you a handout too with all the different types, because there are many different types of calcium or magnesium, and you got to be careful, because if you do like magnesium citrate, guess what? That's what you get when you get a colonoscopy. So you don't want to be taking that and then going out to visit your friends for lunch, So the glycinate is really good because it helps relax you. I take it at night, and that helps relax me to sleep better at night. So I also have taken a magnesium supplement that has 6 different forms of magnesium in it, because there's benefits for all the different forms. So I've taken, one with 6 different types of, hold on a minute, I gotta focus, I don't wanna burn myself.
You said that the body can only absorb 500 milligrams of calcium at a time, so is it better than to break up your calcium? So you're one in the morning, one at night?
Yeah.
And then you said magnesium at night, so when's the best time to take all these different?
I like the food first approach. So I don't think you should get all your calcium necessarily from supplements. So why don't you take your calcium and magnesium at night before bed? So you get 500 milligrams of calcium, and then you're getting your glycinate to help you sleep better, and take that at night before bed. And then focus on calcium-rich sources throughout the day. And what else? When you sleep is also really important for bone health as well. So if you're not sleeping well, magnesium can help you with staying asleep, and also you want to try and aim for 7 to 9 hours of sleep a night. So no scrolling on your phone or watching TV and having the TV on, and falling asleep to the television. That's not good sleep hygiene. So sleep is definitely critical when it comes to bone health as well. I'm just turning these around.
Lots of great questions, everybody. Thank you. Keep them coming. Another one, we're getting very specific, but does vitamin D need to be taken with food to be absorbed, was a question? If you're taking it in a supplement form.
It's a fat-soluble vitamin, so
Allison, you fix your thing.
It's a fat-soluble vitamin, so ideally, fat helps absorb those fat-soluble vitamins, but I don't think you necessarily have to take it with food. I don't, and my vitamin D levels are great. I just had them done, so, and I wear sunscreen.
And sunscreen, yes. Our dermatologist friends would be happy if we left out sunscreen.
So we've talked about overall health, and I know sometimes people come to see you because they've had an injury,
Right, yeah.
and or sometimes they're going to get something done preventive. We hear a lot about prehab now. What are sort of your advice for somebody, either they are recovering from an injury or they're planning on, I don't know, a hip replacement or a knee replacement or something? Is there anything that, in addition to the exercise, are there tips and tricks you give? And it doesn't have to be specific to nutrition, but what's your best advice for folks like that?
Yeah, so I think one of the big things is kind of the concept of gradual return to previous activity, let's say, right? So, and that's where kind of working with the physician is kind of helpful, and working with, if necessary, working with therapists is helpful. But the concept of gradual return to function is I think the ideal. Sometimes some people feel like either they've had the injury and then they said, all right, I've done my rest, I'm back to full. Mm-hmm. And then they want to just come, skip a couple steps. Impatience is very, very common, unfortunately. And so that's one of the key things that I always try and remind my patients is this can take some time. Even something as simple as, or something as very common as back pain, right? Low back pain. And I send patients, let's say, to physical therapy for this back pain, and they come back to me 2 weeks later saying it didn't work. Well,
2 weeks.
2 weeks. And this is one of those things, and I try and warn patients ahead of time that sometimes if you're changing the physical properties, at the end of the day, you're changing the physical properties of your body. Mm-hmm. And that's not a quick change. And that's something that takes gradual build-up over time. And so patience is the one thing that I always try and stress to my patients. No, patience to my patients, but yes, pun not intended. But
there you go. All right. I'm going to be making the smoothie bowl while we're waiting for the egg bites to finish up. The sweet potatoes look pretty good, so I'm going to let them come out and cool a little bit. So this is a great thing to have with a lunch or a dinner. Throw in a salad, and it's a fiber-filled carbohydrate. So I like carbs are not the villain, but the processed carbs are the villain. So having a whole food carbohydrate with fiber in it is going to be beneficial for your health for a number of different reasons. And next, I'm going to make this smoothie bowl.
Say that one, sorry? Oh, like the vitamins or what have you, or?
Infusion for osteoporosis.
Oh, gotcha.
So, physician endocrinologist says you can do it for 2 or 3 years and you stop
Mm-hmm.
because it has to do with fractures.
Ooh.
It's like the bones that are built are more fragile.
So that I'm going to have to defer to the endocrinologist on that one. Yeah.
So you do build bone, but for some reason it's more fragile.
Yeah, I'm going to be honest, I'm not quite sure. Yeah.
I don't know about that either.
More likely to get fractures.
To the folks
I
at
don't
home,
think
the
I'm more
question was
like-
about
I wouldn't think
on
more likely.
Fosamax, an infused medication, if the bones are more fragile. That's what our endocrinologist had said.
I wouldn't think it'd be more fragile, because then why would you opt to do it? It's got to be better than what you were, but it's probably not building bone like you are as a teenager that's drinking a lot of milk or whatever.
Well, they do have to stop it every 2 to 3 years. They will not
Continue it. Yeah.
continue it and then stop for a year or 2 before they do it again.
Okay.
Because there is something unusual about the kind of bone
That is built.
Oh. I don't know.
Yeah.
Okay, this is a peanut butter and jelly power bowl. You can use a plant-based yogurt if you would like, and I pre-made this because I needed to freeze it for you guys. So this also has some honey in it, and I like to use honey that you can find in your farmer's market, if at all possible, local honey, because that means that the pollen that the bees have are local to our area, so that helps decrease our allergies. This I found in Publix, and it's from the Southeast, so as close as I get to a farmer's market. Honey, I'm putting about a teaspoon. I'm Rachel weighing it. I'm a professional, so I'm not measuring it out. And then peanut butter powder. Have you guys tried peanut butter powder before? Have you seen it? I love it. So the ingredients are just roasted peanuts. It does have a little bit of sugar in it and salt, but this has significantly less fat than regular peanut butter. And serving size of peanut butter is like 2 tablespoons. I don't know many people that just eat 2 tablespoons. So having some peanut butter powder is going to give you that flavor of the peanut butter without all the excess fat. And I'm not saying eliminate fat. We're going to eat fat in other areas of our diet, okay? So I'm going to put 2 tablespoons in here. And with your power bowl, I want you to pick out your toppings. I do have lids for your containers, so you could take it with you if you'd like. And then I need some vanilla extract.
So we've got yogurt here, is that right?
Plain yogurt,
Just plain
Greek yogurt.
Okay.
And frozen strawberries. You could use any berry that you want, but I wanted like a peanut butter and jelly sandwich flavor. Honey, and then vanilla extract. And you're going to blend it all together, put it in your individual serving containers, and then freeze it.
And then you freeze it?
Yeah.
Okay.
So you don't have to freeze it, but I thought it tasted better frozen, and then like a dessert kind of thing.
Gotcha.
So, and then you really shouldn't measure over that because you could go overboard, and like, don't do that with salt.
Whoops.
Surprise. All right, so here we go. So as you're doing it, you're going to have to like scrape the sides to make sure it all gets blended in well. I would suggest cutting the berries up a little bit smaller to make this process easier, but basically you're just going to blend it all up and then put them in your individual containers. I'm going to pass around different ingredients. So this is unsweetened coconut flakes. We have the hemp hearts. Have you guys ever tried hemp hearts? This is a good source of omega-3s and protein. So I like adding this to my salads. It has a nutty flavor to it. This is flax meal. So flax seeds are very anti-inflammatory, have good source of omega-3 fatty acids, healthy fats. This is something that one of the physicians I've worked with, instead of having like a salt dish on her counter, she has a flax meal dish on her counter. So it's like, what can I add this to benefit my health? I've told you I don't like fish, so I need to supplement with omega-3s. So I'm putting this on my counter, and I'm putting it in my smoothies, in my salad, in my smoothie bowls, things like that. My kids love homemade waffles, and I do Kodiak cake because it's high in protein, and I sneak in the flax meal into their waffles, and they have no idea. So you could do it in breads, cookies, any baked items, you could add that as well. And then, who doesn't love a little bit of chocolate? We got to add a little bit of chocolate because chocolate is life. And then I also have chia seeds here, and chia seeds are another good source of omega-3 fatty acids. If you are a plant-based person, you're going to be not using eggs in dishes, and you can use flax meal or chia seeds to make an egg alternative. So sometimes I like making a mug cake for breakfast with my protein powder, and it calls for eggs, but I'm like, you know what? I could use the chia seeds or the flax meal and make an egg replacement. Oops, but that's going to help me, boost my omega-3 intake and protein. There is some protein in that as well. Walnuts are a very highly nutritious nut, and then berries are always good for more fiber as well. All right, let's check our eggs.
And we've got the doctor acting as our sous chef. Thank you. So yes, Allison, somebody asked, I'm not sure for the egg bites, somebody asked, could you use ground flaxseed instead of eggs in the egg bites
Yes.
recipe? You can?
No,
Oh.
not for the egg bites. You can't scramble it, unfortunately. It would be gross.
It's more for baking, correct,
Yeah.
or as an added ingredient like that.
Yes, and tofu scrambles are really good. So if you're avoiding eggs, tofu scrambles are a good option. Let's see.
And come back in August when Allison is here with Dr. George Guthrie of Advent Health we'll be doing a plant-based cooking class as well.
Yes.
Last time he was here, we did make the tofu scramble.
Yeah.
I'm not sure what's on the recipes
Yeah.
this time.
I know we're going to be making a delicious dessert that I think it's the chickpea cookie
Oh, the
dough.
chickpea cookie dough.
And it's
Yeah.
made with PB2 and peanut butter. It's so yummy.
Sounds delicious.
So let me get a
As she's doing that, Dr. Kiymaz, there's a question she's a 62-year-old woman and is just wondering, is there any way to speed up cellular turnover to develop more muscle mass and bone strength, as you're in your 60s and 70s?
Besides is speed it up as in more than the natural?
I think so. Or just to make the most of it,
Not to my knowledge. That's
I think
with
you'd be a
good
millionaire if you could figure that out.
research backed.
Yeah.
Because there's certainly you'll see supplement, and I just want to kind of throw that out there. You will see supplements that make claims of various things, not just specific to that, but also just in general. It's not like medication. Supplements are not like medications where there's strict oversight over the FDA. So the rules are a little bit murky with some of those, and that's why I do think it's important to be extra diligent, and when you're reading labels, when you're seeing claims, especially for anything. If it's too easy, then you kind of want to see.
Everybody would do it.
What are we talking here? Is it too good to be true type situation? And me personally, in my personal life as well as in professional life, I'm big on kind of more natural, like we were just talking about earlier, Allison, about getting, food-based, getting your vitamins and your nutrients from food. That is more kind of what I lean towards. I'm a little bit bigger fan of that. And the same thing with activity as well. When you're trying to build muscle mass, more natural in the sense of just daily activity, but also more focused. Sure, it can target certain muscles as well, but kind of just letting it kind of naturally play out, essentially, I think is kind of the best way to kind of go about it.
What
am I doing?
Grab a cup. Yeah.
Oh, a cup? Okay.
See, you guys get all the backstage.
Yeah.
Perfect. YouTube thumbnail. All right. Yay, good. I'm so glad. And then you could save your leftovers for dessert or for breakfast tomorrow. 47, 47, 47.
Great little setup you guys got, yeah.
There you go.
How often do you guys do this?
We do this once a month
Yeah?
with different physicians, and I do it once a month now. It's solo. So
That's awesome.
We have about 4 to 5 cooking programs every month for folks in here.
You're
So
welcome.
this is the only one that's also live streamed, so for folks at home. So
Gotcha.
get in the theater as much as you can. Do you cook at home?
I try my best to do the basic stuff. I can do basics. This is probably bringing shame on my mom, but so I had the benefit growing up. So I'm originally Turkish, and so I had the benefit of a full Turkish cuisine at home.
Ooh.
Which
What's your favorite?
I love the kebabs.
Oh, me too.
Personally.
Yes.
But again, kind of going back to like the variety, it's so nice that I was exposed to such a wide variety of, even within Turkey, like different regions of Turkey has such different cuisines. It's amazing that people can think about all these different dishes and can create that. And I was actually just there the last 2 weeks. I was in Turkey, and engorging myself with all these different foods.
Yum.
I may have gained a few pounds, but that's okay. But interestingly enough, I also walk everywhere there too. That's the other thing is walking everywhere. I'm talking hours in a day, and so it kind of balances us out, I guess, the more I eat over there. But I'm also kind of just living there burns more calories.
Right. And walking after a meal is really good to stabilize your blood sugars too.
It's so incredible that, culturally there, it's kind of interesting that it's kind of ingrained in that culture, especially after a dinner. People will just go out for a walk. Like it's just a normal part of, almost like a part of the dinner itself. And if, you're with family or you're...
Does the cook go walking too? Or is she like, get out of here, I need a break and clean up?
Well, what ends up happening is, the nice thing is everyone just like is trying to pitch in and just be like, all right, more hands, less work type situation.
Yeah.
Once that, or sometimes you just leave it.
Yeah.
Leave it, we'll do it later.
Yeah.
Well, that's a later me problem.
Yeah.
But just kind of going out with family and friends, it's always it's a nice little compliment to the meal afterwards, and nutritionally speaking is also pretty beneficial too.
That's great. Are your parents still there?
So they are half the year they live there,
Uh-huh.
and then the other half they're here in Orlando. So
That's awesome.
yeah, it's nice. Just moved back to Orlando. About with what was it now? 7-8 months.
Oh, really?
Yeah,
You're new.
8 months ago, yeah. Even though I went to Winter Park High just across the street. But,
Nice.
Nice little homecoming for me.
Very cool.
Well,
But
we're
yeah.
going to be wrapping up in the next 5 minutes or so. So this is everyone's last chance for any questions, both in the chat and here in the room. And as a reminder to everybody, we will be sending the full video around to everybody. So if you want to rewatch Allison make something specific or any of the comments you missed today, you can go back, and we've got the recipes in the chat. You will have the recipes here. Everyone do the survey, because as you heard, we do these cooking programs a lot. So we'd love to help make what you guys want us to make. So.
And then if you want to opt in to my email list, I will send you the playback with the recipes and my favorite kitchen gadgets and all the handouts that we were referencing in here. And then after that, you'll get my Tasty Tuesday emails every week in your inbox with lots of different healthy, tasty recipes to inspire you to get in the kitchen more often.
And that link is in the chat as well. So, and I've also put a link to Dr. Kiymaz's site, so you guys can go and watch a great video with him and learn more about him and the work that he does at Rothman Orthopaedics and that big, new, beautiful building downtown. If you guys haven't seen
Would
it,
you
right
like
there
it?
along
Okay.
I-4, it's beautiful.
It is. It is.
So are you down there, or are you across the street?
So I'm at Winter Park 1 to 2 days a week, and then I'm also at Lake Nona as well as my other site, and then I'm at Innovation as well 1 day a week. So a little mix of everywhere. Yeah.
Very nice. So, what do you think? Have you guys tried the eggs yet? The lemon vinaigrette?
Sweet potato.
The what?
The sweet potato.
Uh-huh. Yeah. I was trying to mimic a dish from First Watch that has the sweet potato, arugula with a lemon vinaigrette and eggs anyway. And then I was trying to imitate the Starbucks egg bites. So if you were to make these at home, what other ingredients would you put in your egg bites if you wanted to change it up? Spinach, yeah, that's a good one. Onions, yep. The what?
Goat cheese.
Goat cheese, that would be great. So it's really like use that recipe as a template and add whatever vegetables you have on hand. And like I said, I always have excess vegetables. So I will, what I like to do is make a salad bar in my fridge every week for meal prep. And I'll chop up all my ingredients, store them in clear containers. So when I open up the refrigerator, my kids open the fridge, they see all these beautiful colors, and they're more likely to use them and eat them. So I could have a variety of salads any day I want, but I also have the chopped up ingredients for recipes. So if I want to make fajitas one night, I've got the peppers and onions done. If I want to do a stir fry, I've got all the ingredients for a stir fry already done. And so in my freezer before I went out of town this past weekend, I have little diced red onions. So that you better believe is going to go into some sort of scramble or an egg bite when I want to use that in the future.
Now, what did you put the onions in?
The onions are in the egg bites. So I pre-did that because, like you saw me doing the cheese, that I should have put the cheese in it in advance. It was taking a lot of time. So all I did was take the cut it over that and chopped it. And then since the red peppers are so soft, I didn't even have to take a knife. I just broke it up in the muffin tin. Yeah. So, all right. Any questions?
How do you like your weighted vest?
I like it, and I've only used it a couple times.
The question was about Allison's weighted vest.
Yeah, I should have probably bought it in the winter. So.
Just wearing a camelback or something.
Yeah, and I went to St. Pete because my son just moved away to go to college, and so we are waiting for him to wake up because college kids, they sleep in, and so I'm like, I'm gonna try my weight vest. Let's take a video of me with the weight vest, and I'm like, okay, let's go back to the hotel, and I'm dropping off the weight vest. It's too hot right now, but from what I've read, you're supposed to get 10% of your body weight. I have a little bit less than 10% of my body weight, and if you're starting out, I probably go less than 10% of your body weight and build up. But you don't have to be all fancy and buy a weighted vest. You can get one of those little drawstring backpacks that people give away at festivals all the time and put frozen water bottles in it. And then as you're walking, you could drink, it's cooling, and as you can drink it and throw out the water bottle and recycle the water bottle on your walk. So try that first before investing in a weighted vest.
Well, thank you, everybody. I'm going to stop the recording just for our folks at home. We'll keep the room open a few more minutes with the links. But thank you, everybody, for coming today. We hope you all had a great time. And then thank you, Dr. Kiymaz, for your time and expertise. And we hope to have you back here again soon.
Yeah,
Absolutely.
Thank you.
Thank you, guys.